Dear Professor von Braun, dear Professor Michael Baumann, dear fellow academicians, colleagues, friends, first of all, thank you so much for giving me the opportunity to speak to you today. I'm Elisabete Weiderpass, the director of the International Agency for Research on Cancer of the World Health Organization. And I'm going to speak today about the increasing worldwide cancer problem and inequalities in prevention and care. And I will illustrate with examples from the International Agency for Research on Cancer. In the first slide that will come up very soon, you are going to see data from the Global Cancer Observatory that we curate at IARC. It's nicknamed GloboCan. And the most updated data worldwide is from year 2022. And this data indicated that there are about 20 million new cancer cases globally and almost 10 million new cancer-related deaths. And I will show you, I hope, that the top 5 cancer types in both sexes and the deaths, and which are the most important ones. And no surprise, lung cancer was the most frequently diagnosed cancer case in 2022, representing almost 2.5 million new cases, so 1 in 8 cases worldwide, 12%, followed by cancers of the breast and colorectal. Lung cancer was also the leading cause of cancer deaths, being responsible for almost 19% of all cancer deaths, 1.8 million, and followed by colorectal cancer, almost 10%, liver cancer, female breast, and stomach.
I think the slides are now ready, so if we can have them up, you can start all over again.
Colleagues for this technical mishap. And we go to slide 2. So we go from the States to the world now. And I will just revise with you the statistics globally to have an overarching scale of the problem. So 20 million new cancer cases and almost 10 million new cancer-related deaths in the most recent statistics we have worldwide, which is 2022. And the chart shows the top 5 cancer types in both sexes, incidence and mortality. Lung cancer was the most frequently diagnosed cancer, 2.5 million new cases per year, 1 in 8 cancers worldwide, followed by female breast, about 12%, and colorectal, about 10%. Lung cancer was also the leading cause of cancer death, responsible for approximately 1.8 million deaths, followed by colorectal, liver, breast, and stomach. So demographic-based predictions conducted by IARC estimates that the incident cases, the number of new cancer cases, will reach 35 million by 2015. That's a 77% increase from the total numbers in 2022. The greatest increases are proportionally predicted in low and middle income countries. And inequalities are expected to grow unless resource-dependent, effective, and cost-effective interventions are implemented. And some of these, which are proven to be cost-effective, are certainly tobacco control and HPV vaccination, in particularly in low and middle-income countries. So there is an opportunity for prevention and to avoid a very large chunk of these potential incidence and mortality cases. The global mortality now. So we had 10 million in 2022, and we will grow to almost 17 million by 2045. Again, the greatest increases in mortality will be seen in low and middle income countries. And here, access to affordable diagnosis, equitable treatment are very crucial and lacking in many, many countries. So let's start a deep diving some of the main cancer types, starting with lung cancer, the most frequent one in 2022. We analyzed the global variation and also the trends over time by histological type. And the data I'm showing has been published in the Lancet Respiratory Medicine recently. So what we showed is increasing risks among younger generations, in particularly females, in most countries we assessed. And this is is a trend, really, that we are pretty sure is a real trend. In women, probably is smoking initiation that's causing it, and indicates also that targeting women, in particular young women, is quite important. But we also believe there is a important risk related to particulate matter pollution, PM, and these affect mostly East Asia and in particularly China. And these results provide insights that both lung cancer and the underlying risk factors are evolving over time and give us clues on how to tackle these risks now and in the future. And also indicating that environmental policies will definitely affect lung cancer incidence and mortality. Let's move to breast cancer. And this is also a study that we did indicate that 1 in 20 women worldwide will face a breast cancer diagnosis. In some regions of the world, is 1 in every 8 women. If current trends persist, breast cancers and incidence and deaths are projected to rise, and in particularly for mortality, it's about 40% by 2050. And countries which are classified as low development index will have the highest increase proportionally. And it also indicates that it's rather urgent and crucial to focus as much as possible on prevention and early diagnosis for breast cancer. Moving to colorectal cancer, the incidence here is increasing in younger adults, defined by aged less than 50 years, in multiple high-income Western countries, in contrast with stabilizing or decreasing trends in older adults, defined as over 50 years of age. In this data that I'm showing here, we looked at trends in different parts of the world, and the graphs illustrate trends by age group. The increased incidence rates among younger adults, in contrast with decreasing or plateauing rates among older adults, are primarily observed in North America, Oceania, and several European countries. The findings also show that the rising incidence of early onset colorectal cancer is no longer limited to high-income countries, but also is observed in Latin America and the Caribbean, in Asia, and in Eastern Europe. Early onset colorectal cancer rates are rising in 27 out of 50 countries and territories where we have very reliable data, underscoring the need of intensifying efforts to identify factors driving these trends and increase awareness to help facilitate early detection. I'm going to show some results of the Mutographs study, which is one of the Cancer Grand Challenges that aims to understanding the causes of 5 different cancer types in 5 continents by generating mutational signature profiles. Through whole genome sequencing of 981 colorectal tumors in 11 countries with varying incidence rates, we identified several signatures, including Colibactin signature. And this study has just been published a few weeks back in Nature. Colibactin signature resulting from PKS plus Escherichia coli exposure has been associated with colorectal tumorigenesis. And the higher prevalence of Colibactin signature in tumors from younger patients suggests that early life exposure to Colibactin-produced bacteria might be a key driver of the risk of early onset colorectal cancer that we just discussed. So it would be really important that other groups further investigate if these findings are or not confirmed and explore further this hypothesis. Let's shift our focus to prevention, which is, as Professor Ulrich Ringborg and Doug Laurie also mentioned, a very powerful driver for impact and at our hands to some extent to deal with. And this is I studied it with INCA France, so thank you Thomas Dubois for having participated on it. And we calculate the population attributable fractions of different risk factors for France. And what we found is smoking 20%, alcohol consumption 8%, unbalanced diet 5%, body weight, excess of body weight and obesity 5%, infections 4%, and occupational exposures 3.6%. So in France, at least 40% of all new cancer cases could have been prevented if we were able to tackle these risk factors leading to these most frequent cancer types. We did the same exercise for the European Union countries, and our conclusion was that 1.3 million cancers, 33% of cancers are avoidable in men and 44% in women, would be preventable with knowledge we already have. So clearly, implementation is key here. So this infographics shows the results of a new modeling study using population-level data to evaluate the impact of eliminating tobacco with tobacco-free generation initiatives. And it indicates that if we were to prohibit the sale of tobacco to people born between 2006 and 2010, we could prevent 1.2 million lung cancer deaths by 2095. The infographics also shows the number of cancer deaths expected to occur amongst the 2006 to 2010 birth cohort, and the number that could be prevented if tobacco were eliminated. And it's divided by gender and also according to the World Bank income group, high income, upper middle income, and lower income groups. We continue to provide support to the World Health Organization Global Initiative, in particular the cervical and the breast cancer initiatives, through a series of studies and collaborations. In this example, on cervical cancer elimination initiative, we are providing data to evaluate the promotion of cost-effective cancer prevention strategies. So the three WHO initiatives are breast, cervical, and childhood cancer. And cervical cancer is the most active strategy currently and the most advanced one. We have been analyzing key performance indicators also for the breast cancer initiative in Africa and indicating how fast or slow is the progress in this area. And this graph indicated the different KPIs for the breast cancer initiative. And these pillars are health promotion for early detection. The second is timely diagnosis, and the third one is comprehensive breast cancer management. And the KPIs, the first one is more than 60% of invasive cancers are at stage 1 or 2. The second one, completing diagnosis workup within 60 days of the first presentation to the healthcare system. And the third pillar is more than 80% of patients undergoing multimodal treatment without abandon. Our analysis aimed to assess whether it was possible to measure each of these key performance indicators, and in doing so, document the challenges in obtaining the required data and applying the definitions that of these KPIs in practice. And this study was conducted within the framework of the African Breast Cancer Disparities and Outcome Cohort Study. And what the figure shows is that the progress towards the global initiative pillar KPIs benchmarks by country and race. And clockwise, the pillars 1, 2, and 3 are represented, and the fully shaded area representing the progress towards the benchmark indicated by the red line. And this study demonstrates that it's feasible of tracking the global initiative of breast cancer success in hospital settings, directly supporting the WHO framework of breast cancer prevention and care. So we conducted also an implementation research to support countries in implementing the HPV vaccination intervention. And actually this study I studied that preceded for a few years, the study that Doug Laurie mentioned in Costa Rica. And so we looked at the effectiveness of HPV vaccination, comparing 1, 2, or 3 doses in a large cohort of Indian girls, and we found results that are very similar to the Costa Rican study. And you can see in the graph 90% with 1 dose effectiveness, 92, almost 93% with 2 doses, and 93% with 3 doses. And this was over 15 years, 10 years follow-up, and now we have replicated with 15 years follow-up. So very reassuring data indicated that most likely 1 dose is the most cost-effective way to proceed to make use of the limited amount of vaccine doses that we have today. And on the right hand of the slide, I just indicate that how long it will take for us to eliminate cervical cancer in India. It will actually take several decades until we reach the plateau of 4 per 100,000 in India if we actively implement the vaccination stepwise in the next decades. The idea of 1 dose has already been implemented in several countries, and here I put the map of Brazil, indicating that several states of Brazil are now in full-fledged implementation of 1 dose. And we see this also being adopted in China, and most likely EU will follow suit. And the UK, I believe, has also been changed to 1 dose following the SAGE recommendations. So in this study, we are highlighting the potential to eliminate HPV-associated cancers, focusing on critical cofactors such as the social determinants of health in Europe. This study emphasizes that mortality for cervical cancer is closely linked to the socioeconomic status of women and the Human Development Index of the countries. Inequalities in cervical cancer mortality attributable to level of education were observed in every country in Europe. Mortality was higher in women with lower education levels relative to those with intermediate and especially high levels of education. The study also showed that the magnitude of these inequalities varies greatly across countries, being smaller in those with higher Human Development Index, for example, in Northern and Western Europe, and larger in those with lower Human Development Index. Therefore, elimination efforts are unlikely to succeed unless prevention efforts focus on health equity with a commitment to both primary and secondary prevention. Prompted by findings of the ABCDO study in Africa, we calculated the number of children who become maternal orphans upon the passing of their mothers to breast cancer deaths. And we also extended this study to a global perspective. And the estimates globally that we took into consideration regional variations and country-specific numbers is that new and existing maternal orphans due to cancer in 2020 are as follows. 1 million children become maternal orphans every year, at least. And by no coincidence, deaths from breast and cervical cancer, which are the 2 female cancer types targeted by the WHO global initiatives, are responsible for half of all maternal orphans. Asia and Africa had most of these orphans. And this work further illustrates yet another reason for global action on preventable and premature cancer deaths which drive an intergenerational cycle of poverty. So very briefly, some take-home messages. The overall cancer incidence and mortality differ markedly between countries according to Human Development Index, and the greatest increases are predicted in lower resource countries currently assigned a low Human Development Index. These are countries undergoing major social, economic, and demographic transitions. Cancer inequalities can only be expected to grow unless resource-dependent, effective, and cost-effective preventive interventions are implemented urgently. Fostering innovation and implementation research is key to discover cost-effective interventions that resonate with the specific needs of low and middle-income countries. Incidence and mortality of HPV-related cancers are closely linked to socioeconomic status of women and to the Human Development Index of countries. Therefore, successful elimination requires a focus on health equity and a commitment to both primary and secondary prevention strategies. Thank you very much for your attention, and I will be happy to answer any questions.